The Heart and Stroke Foundation says 5 people will likely suffer heart attacks and 10 will experience a stroke within the hour in South Africa. This puts cardiovascular disease as one of the leading causes of death in the country, followed by HIV and AIDS. Let's talk about this with Dr. Brenda Watson from Life Springs Parkland Hospital. A very good afternoon to you, Doctor. Thank you for your time and patience today. So the issue of strokes and heart attacks, we talk a lot about heart attacks, but do we underestimate how prevalent strokes actually are?
Absolutely. And we see the devastating effect after stroke with disability and the prevalence currently in our country.
How prevalent is it? I mean, I was reading out some stats there from the Heart and Stroke Foundation, but from someone who's actually in an emergency unit, how often do you come across people who have experienced strokes?
Data shows us that 1 in 6 people will have a stroke in their lifetime. In Africa, we have a 2 to 3-fold higher prevalence compared to Western Europe and USA. In our unit, we see up to 7 severe strokes a month.
And when you say severe strokes, are these people who would not be able to recover even with, let's say, physiotherapy?
Yes, so these are patients that will have some sort of disability or symptoms left over after completing rehabilitation, depending on the cause of the stroke and obviously the symptoms that they presented with. But yes, these are considered severe strokes.
And in terms of why it is that we are at such higher risk compared to other parts of the world, is it all lifestyle related?
Yes, when we talk about risks for strokes, we look at lifestyle as the main contributing factor. Poor diets, not exercising enough, family history, having hypertension, diabetes, cholesterol, other cardiovascular diseases, as well as smoking and using other drugs or illicit drugs.
Mm-hmm. And for those of us who've not experienced or been around someone who's suffering a stroke, what is usually happening physically?
First of all, I want to emphasize how important it is to see stroke as an emergency. This is an emergency event and should be handled as such. When we want to make people aware of the signs and symptoms of stroke, we endorse the American Stroke Association's FAST acronym. FAST is for easy letters to remember. Face is the first one, F, where you look at the patient's face for facial drooping. You can ask them to smile and it's easily identifiable. The second one is A, arm. There will be numbness or weakness in the arm. This is assessed by asking the patient to raise their arms. Then S is speech. Usually patients with strokes have speech slurring or difficulty speaking. You can ask a simple phrase and ask the patient to repeat it. And the last one, and as I mentioned, the most important, time. Getting these persons or patients to an emergency facility ASAP is the most important. So call 911 or your local emergency services or take this person to your local ER.
And for those who in South Africa, sadly, the majority, would not have a personal family vehicle, would maybe have to go find a neighbor or someone 2 streets away, is there anything that can be done in that period while A, trying to find a car to help you get to hospital or while waiting for an ambulance to come assist?
We can give the patient, if it is available, a disprin, but other than that, keep the patient calm and get help ASAP.
And when I was growing up, at least, the idea of a stroke was often associated with older people, but growing up now, I hear of people in their 20s, in their 30s who suffer strokes. Is that unusual?
It is unusual, but not in these days and times as uncommon as it used to be, as you say. And that is all contributed to lifestyle, the way we're living, our bad eating habits, not exercising, and people not going for their regular checkups. Screening is very important. Having your blood pressure, your diabetes, your cholesterol checked often is so important in terms of preventing your risk. It can be done at a local clinic or your local physician.
And you and I spoke earlier about severity. Perhaps let's run through the different levels of severity for stroke sufferers and the chances that one has of rehabilitation?
Yes. Again, we at Life Healthcare have an integrated stroke program where a patient is received an ED and goes through the 5-step program with acute care, intensive care, and then the acute rehabilitation program, which in my opinion is extremely important because this is where we restore the patient's function and decrease the chances of disability. This differs from patient to patient. Again, the accessibility that a patient has, socioeconomic circumstances, medical aid, etc.
And between male and female, is it still men who are at higher risk?
Yes, men have a higher risk and anybody aged above 55.
All right, Dr. Brenda Watson, thank you so much for speaking to us today.